The topic is hypertension. This topic covers the following heads: definition, classification, etiology of essential hypertension, pathogenesis of essential hypertension, pathogenesis of secondary hypertension, consequences of hypertension. Definition: sustained resting blood pressure of more than 140/90 millimeters of mercury is termed hypertension. Classification. First classification: primary or essential hypertension, the cause of which is not known. Secondary hypertension, disease of the kidneys, endocrines, or some other organs constitute secondary hypertension. Second classification: benign hypertension, which includes 90 to 95% of the cases. There is a moderate elevation of blood pressure, slow rise over the years. Second one is malignant hypertension. There is a marked and sudden increase of blood pressure to 200/140 millimeters of mercury or more. Develops papilledema, retinal hemorrhages, hypertensive encephalopathy. If not treated effectively, life expectancy will be less than 2 years. Etiology of essential hypertension. Genetic factors play an important role. Other risk factors include age. Younger the age at which hypertension is first noted but left untreated, lower the life expectancy. Sex. Females do better. Atherosclerosis is accelerated. It may be due to a contributory role of cigarette smoking, obesity, diabetes mellitus. Pathogenesis of essential hypertension. Contributed by high plasma levels of catecholamines, increase in blood volume producing arterial overfilling, arteriolar constriction, increased cardiac output. Pathogenesis of secondary hypertension, which includes renal hypertension and endocrine hypertension. Now, renal hypertension. Activation of renin-angiotensin system. Angiotensin II is the most potent naturally occurring vasoconstrictor substance. Sodium and water retention. Release of aldosterone from the activation of renin-angiotensin system. A reduction in the glomerular filtration rate produces proximal tubular reabsorption of sodium. Pathogenesis of endocrine hypertension. In the adrenal glands, Cushing syndrome and primary aldosteronism may lead to hypertension, whereas in the thyroid gland, both hypo and hyperthyroidism may contribute to endocrine hypertension. Consequences of hypertension. In the blood vessels, it may produce hypertensive arteriosclerosis. In the heart, it may give rise to hypertensive heart disease. In the kidneys, nephrosclerosis. Nervous system, stroke. In the eyes, it may give rise to hypertensive retinopathy. Hypertensive arteriosclerosis affects the arterioles. It includes hyaline arteriosclerosis, hyperplastic arteriosclerosis, necrotizing arteriolitis. Hyaline arteriosclerosis. It is a common arteriolar lesion that may be seen physiologically due to aging or may occur pathologically in benign nephrosclerosis in hypertensives and as a part of microangiopathy in diabetics. Morphologic changes. The visceral arterioles are particularly involved. The vascular walls are thickened and the lumina narrowed or even obliterated. Microscopically, the thickened vessel wall shows structureless eosinophilic hyaline material in the intima and media. You can see the diagram of hyaline arteriosclerosis where hyaline-like material is deposited in the intima and media. Hyperplastic arteriosclerosis. The hyperplastic or proliferative type of arteriosclerosis is a characteristic lesion of malignant hypertension. Other causes include hemolytic uremic syndrome, scleroderma, and toxemia of pregnancy. Morphologic features. The morphologic changes affect mainly the intima, especially of the interlobular arteries in the kidneys. 3 types of intimal thickening may occur. 1. The onion skin lesion consists of loosely placed concentric layers of hyperplastic intimal smooth muscle cells like the bulb of an onion. The basement membrane is also thickened and reduplicated. 2. Mucinous intimal thickening is the deposition of amorphous ground substance, probably proteoglycans with scanty cells. 3. Fibrous intimal thickening is less common and consists of bundles of collagen, elastic fibers, and hyaline deposits in the intima. Severe intimal sclerosis results in narrowed or obliterated lumen. With time, the lesions become more and more fibrotic. See the picture of hyperplastic arteriosclerosis. Necrotizing arteriolitis. In cases of severe hypertension and malignant hypertension, parts of small arteries and arterioles show changes of hyaline sclerosis, and parts of these show necrosis, or necrosis may be superimposed on hyaline sclerosis. However, hyaline sclerosis may not always be present in the vessel wall. Morphologic features. Besides the changes of hyaline sclerosis, the changes of necrotizing arteriolitis may include fibrinoid necrosis of vessel wall, acute inflammatory infiltrate of neutrophils in the adventitia, edema and hemorrhages often surround the affected vessels. The picture of necrotizing arteriolitis. Hypertensive heart disease manifests as left ventricular hypertrophy. Nephrosclerosis. This includes benign nephrosclerosis and malignant nephrosclerosis. This is a diagram of a photo of benign nephrosclerosis, where you can see granular depressed scars on the surface of the kidney. This malignant nephrosclerosis, or otherwise known as flea-bitten kidney, due to the presence of small petechial hemorrhages on the surface of the kidney, giving the appearance of a flea-bitten kidney. Stroke, which includes intracerebral hemorrhage, mainly caused by hypertension, and subarachnoid hemorrhage. Hypertensive retinopathy. Retinal capillary vessels are narrowed, causing ocular lesions due to retinal ischemia. Thus, we have seen that systemic hypertension causes major effects in 5 main organs: blood vessels, arteriosclerosis, heart, hypertensive heart disease, kidneys, benign and malignant nephrosclerosis, nervous system, stroke, and eye, hypertensive retinopathy. Arteriosclerosis is a term used for thickening and hardening of the arterial wall. Hypertensive arteriosclerosis affects arterioles and includes hyaline thickening, hyperplastic proliferative change, or necrotizing lesion. Hypertensive heart disease results from systemic hypertension of prolonged duration and manifests by left ventricular hypertrophy. Benign nephrosclerosis is a term used to describe kidney of the benign phase of hypertension and is the most common form of renal disease in persons over 60 years of age. Malignant nephrosclerosis is less common but more severe form of renal disease that occurs in malignant or accelerated hypertension. Hemorrhage into the brain may be traumatic, non-traumatic, or spontaneous. There are 2 main types of traumatic, non-spontaneous intracellular hemorrhage. intracerebral hemorrhage, usually of hypertensive origin, and subarachnoid hemorrhage, commonly aneurysmal in origin. Retinal capillary vessels are narrowed in hypertension, causing ocular lesions due to retinal ischemia. Thank you.